the small.
So it goes on the high speed.
High speed? Okay.
You'll set up your relay. You'll also have, I think they want you to have an air water syringe, but I'm not going to use it, so it's okay. And you'll have all of this. It'll say gauze, everything, right?
I don't know if this is how you set it up.
Yes, yeah, that looks about right. So for your true patient, you'll insert this here and then go ahead and turn it on, see if it'll, yeah, there we go. Be careful because sometimes it can start to pinch the cheek, and so you just want to ask your patient if they're comfortable and if they feel okay. So you can either do here or on this side. Okay, and you're doing the same exact thing. So for now, I'm gonna set it over there.
Okay.
Just so y'all can hear what I'm saying. So when you get here and you're setting up, because you're not actually having to connect it to anything, you just want to check all your water sources. You want to make sure that all your cords are connected, you know, that the power is on. There's a switch somewhere in here that will get you
I think there's, yeah, it's right there in the very back. So a little bit right
up here. Okay, there you go. Switch. Okay. And then I'm gonna take this out just so we can look. You'll have this part that's in a different bag. And so you will attach, the first thing you do, you attach your handpiece on here. When you're attaching, make sure all the threads match. So you're not inserting and twisting, because if you do, then you can tear the threads and it'll break it. So it's just like a
straight up and
yes,
down.
straight up and down. Yep. Purges the water through the handpiece without the insert attached for 2 minutes at the start of the day and 30 seconds. So you want to remember those numbers, okay? And some students do it into the sink. I believe if your Cavitron is on that side, you can purge it into the sink. If it's not, then you will be purging it into a cup. Okay. 2 minutes, 30 seconds between patients. After that, is there a cup available?
Yes.
After that, you're going to fill it up all the way. Okay, thank you. Until you start to see the water get close to the top, and it'll create like a little dome almost. Okay, so I'm going to stop right about there. There's a dome on there. And then you will grab your actual ultrasonic and you'll lubricate, okay?
Okay, that's lubricate. Okay.
You're gonna now insert all the way. There you go. Thank you. Until the O-ring locks. So you'll feel it. It'll just feel more snug once you get all the way in there.
Okay.
Select the correct power settings, and so you want to read through all of these and memorize those numbers and memorize what type of calculus it's for, what type of deposit.
So lower power 535, medium power 465, high power 70 and 100.
Yep.
Yes, and then your power setting is here, okay? So you can move this up, move this down, okay? Your water setting is down here, okay? So, you know, 1 being the lowest, 10 being the highest, okay? You'll check it here in just a second. I'm gonna put it on 15 to check. Let me see, adjust the water so there's a steady drip. Okay, I'm gonna get this closer to y'all. I'm gonna bring it like right here on this plastic. So you'll hit the foot pedal, and you'll want to see a steady mist around the instrument where it's spraying water out. So I'm going to turn the water up just a tiny bit so it creates more of a mist. You'll want like a steady mist. That's creating more of a mist. I don't know if y'all can see it.
Yeah, you can see it.
And it's dripping, okay? You can do maybe your drip a little less if you want, but it is dripping. So it's not just a straight shot. I'm going to show y'all just a straight shot of water here so you can kind of know what you don't want. There's no drip on that one, if y'all noticed. It's just kind of going. See?
Oh,
Yeah, okay. So you'll kind of have to do a combination of turning this up or down a little bit and then adjusting your water. But earlier we had a drip, which we were lower. And you'll have to show this to your instructor the day of your comp. Okay. I think we're good here. Okay, I'm just gonna leave it at that. There we go, that's better. Mist, and we have our drip. Okay. I missed. Okay, and then also memorize this part. Low to medium power water is fine mist, and because your instructor might ask you some of that, right? Inform CI of what a nodal point is. You're gonna have to demonstrate the location and inform your instructor of what the importance of it is. So pretty much the nodal points are at 4 millimeter section of the insert. So it's somewhere right around here or so. After that, it's not active anymore. And so it'll say it on here. This is an area of inactivity, and if it is applied to the deposit, it's not going to do anything. It's not going to remove it. Okay? So nodal points are at the 4 millimeter section of the insert. Right around here or so. Okay. Explains the procedure to the patient. If it's your partner, you want to tell them, I'm going to use an instrument, makes a little bit of noise, spray some water. If you get uncomfortable at any point, just kind of raise your left hand and I will stop, or something like that. Let them know what you're going to do. Let them know why you're doing it, that it's going to help remove calculus deposits. Don't just get in there and start doing it. So where are we at now? Okay. And of course, when you're explaining it to the patient, they'll be sitting up. After that, then you start to put on your face shield, lean them back, and you're gonna use the correct grasp. So they want you to use finger and thumb, and then this one goes further. Your middle finger kind of goes further up. Finger and thumb on the handle, and middle finger advanced forward onto the insert. The handpiece is rested in the balanced position in the webbing between the thumb and the finger, and you're going to use an extraoral or intraoral fulcrum. So we're going to insert at a vertical orientation for supragingival. Okay, so vertical and transverse are for supragingival surfaces. So, okay, let's turn on the light. There you go. I'm gonna do upper teeth just because they're bigger and that way y'all can see better. So for me, this cord, I hold it like this, okay? Some students I have seen hold it like this. All right, so it's not in the way. Okay, either way is fine. I'm just used to holding it this way. So if you are inserting vertically, it's up and down like a probe. Okay, this is vertical. That's vertical orientation. And you're going to use the lateral, so the sides of the ultrasonic scaler or the back of it. You do not use the face. Let me double check that that's what it says on there. Back and lateral surfaces. Same thing when you're in transverse orientation. It'll be the lateral and the back surfaces to supragingival. Okay, so everything is supragingival.
Can
So
you start at the midline? or the middle of the tooth?
Yes, yeah. With your scaler, with this instrument, it's not going to matter a whole lot where you start because you're going to kind of be going along the tooth, and you'll be using horizontal strokes, vertical strokes, oblique strokes, but you almost have to do the whole tooth. So if your instructor says surfaces away from you, yes, you're going to probably start at the midline, go this way. Or if they say surfaces towards you, same thing, you'll start at the midline, okay? If for some reason you're on your own, and you're here on tooth 7 and you're gonna go from 7 to 10, then you probably don't need to start at the midline. You'll be doing something like this. You'll be doing something like, this is my transverse insertion, okay? Which is like a sickle scalar almost, okay? And it's for interproximal, supragingival, right? So if you're on your own, you would do something like this and then bring it to the facial, okay, using either vertical, oblique, or horizontal strokes, and then you would go back to transverse for interproximal.
And then if surface away from you, do we need to turn the instrument?
So if your instructor tells you surfaces away from you, do you turn the instrument? Yes, you always have to turn the instrument to either you're using the lateral or the back.
Okay.
Yes, always, always. So if you're not, if your instructor says surfaces away from you and you adapt facial with the face of it, then that's not okay. So you have to turn the instrument, yes, or rotate it or move it to where you're like, okay, I'm now using the lateral end.
Oh, the lateral end.
The lateral end, and I have to go interproximal. So for interproximal, you go to transverse.
Oh.
And now you're in transverse.
But we don't need to turn the tip like the other instrument. We like the surface away from you, the tip and away from you. This one different, right? Yeah.
So I think what she's referring to is when, say for instance, we are doing the Explorer and we're going surfaces away, and then well, you won't flip it.
Did y'all ask him for it? Said yeah, because on the thing it said.
For education.
Oh, they can?
Can I take a video?
Because it said no, so I didn't know.
I'm letting him do
Okay,
it,
okay,
yeah.
okay. 'Cause I had told
We're
them
all
that.
gonna be out here,
Okay.
because a lot of them didn't even get to ultrasonic, and there's so much more, so we're gonna do ultrasonic, and whoever didn't do your curette, I'm staying after to do the
curette.
whole thing of your curette.
Okay.
If you're,
I can
Yeah.
stay.
don't think, yeah, so they're gonna stay after, but I'm gonna have them pair up with someone out here. We'll go ahead and just, if there's op available, just put the,
Okay, so she wants me to finish this?
Yeah.
Yes.
Okay, I'm sorry.
No, you're
I
fine.
had told my this morning no because she had put it on big bold letters that they couldn't.
Yeah, you're right. You're
So,
right.
okay,
I
guys,
know.
didn't
That's
remember.
probably me breaking the rules. I know. Whoops. Yeah, she did. She did. It's on there. I can see it. Okay.
Yeah.
So back to your question again. You're trying to ask me something, and she is too.
So, like, okay, sickle. Sickle sounds better than
Yes, sickle
Explorer.
sound-
For the sickle, when we're doing surfaces away, and then we like
Yeah,
kind
yeah.
of that.
Yeah,
what you
we
just
kind
did?
of do like this, like we kind of
She's
do like
saying-
this. Yeah, so we do like this for the circle. Oh yeah, but then it's pointing the tip.
Yeah. No, you insert still like a probe.
Oh.
Yeah, because this is an ultrasonic scaler. So for sickle, yes, I know. So for sickle, you're inserting
Yeah,
like this,
like
is what
that,
you're
yeah.
saying.
Yes.
Yeah, no,
But
that's
no,
only
no,
for
no.
sickle.
Only for
This
sickle.
one is like a probe.
Yeah, the pro. So we're gonna do.
Yep.
Like
And
the-
so this one you're focused on, I'm on the facial, so I adapt like a probe. And then I start my strokes,
Okay.
whether they are horizontal or vertical or oblique. Yeah, no, sickle, you're right. Sickle, you go in almost this way, right?
Yeah.
Yes.
Yes.
So it's different.
Yeah, it's different.
It is different. Now, as much as you can, Ms. Fraga does want you to focus on, surfaces away from you. You would sit further over here. surfaces towards you, you know,
Come to now.
over this way. So yes, so if your instructor is specific and says, I want you to specifically do surfaces towards you, then you have to think in your brain, I have to move this way. Now, if your instructor does not say that, and all they say is, do tooth 6 through 11 for me, then you know, you can kind of take charge and say, okay, you know, here I am at the, you know, I'm inserting transverse, and I'm, you know, going interproximal. Now I'm on the facial, so I'm going to adapt with the lateral surface, or you can also use the back, you know. And I'm doing my strokes. Okay, and now I'm going interproximal again, so transverse. Okay. So it kind of depends on what your instructor is requesting of you in that moment. Okay.
Okay. Can you send that video in the group?
Yeah, I'm gonna edit.
I ain't got no storage.
You're adapting only the last 1 to 3 millimeters. I feel like I can go slower now because I was
We're
like
all-
trying to rush through this. So if y'all didn't understand some of the first part, let me know and I'll go through it again.
Okay.
You're adapting only the last 1 to 3 millimeters of the working end to the tooth deposit. Adapts the back and lateral surface of the insert to the tooth. So we talked about that already. The back end and the lateral, the sides. Oh, thank you. Demonstrates a tapping motion on moderate to heavy deposit. Okay, now we're moving on to moderate to heavy. So the two that I just demoed, which were transverse and
The lateral.
yes, was super gingival, right? Okay, now we're gonna pretend like we have a wall of calculus or just heavy deposit that starts up here, okay? So for this, you're using tap, 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 and stroke, stroke, stroke technique, okay? So if you're pretending that the calculus is all the way up here, you adapt and then you do tap, 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 so kind of like 3. It's almost like you're hitting the top of the wall or the top of the calculus. Tap, 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 and then you do stroke, stroke, stroke.
Okay, and that will if
Start-
it's in the gum. It'll break it down.
Yes,
Okay.
it'll start to break it down because harder deposit isn't going to come off if you're just coming in and, you know, doing this or this. Like it's almost like you're breaking at something. You're breaking at. The reason I say a wall is because sometimes some patients will develop, it's almost like a wall of calculus all along.
Okay.
So, and you use tap, tap, tap. So you're tapping at the top of it, and you're using stroke, stroke, stroke. Move a little further down. Tap, tap, tap. Stroke, stroke, stroke. Okay, that's for moderate to heavy. Keeps the insert angulated at 0 to 10 degrees to the tooth surface. So we remember 0 is almost like you're laying down against the tooth. 0 to 15 is you kind of open up away, a little bit away from the tooth. That might have been too much. So 0 to 15. Never the tip. You never use the point. Okay. What else? Let's see here. Moves, insert, and channeling strokes no more than 2 millimeters back and forth. So channeling strokes are kind of almost like side to side, and channeling strokes, it doesn't say it on here, but I'm going to pretend that I have a piece of calculus down into the pocket. Okay, so I start here and I start using my channeling strokes going down into the pocket till I reach the piece of calculus. Okay, those are your channeling strokes.
With
Subgingival debridement proceeds in a coronal to apical direction, the depth of the pockets. So yes, so that means the same thing. You're starting up here, coronal to apical with any channeling strokes.
okay, so it's building up to get into sub. So the tap, tap, tap is breaking it down, and then the 0.10 degrees. I get. Okay, that makes
The 0
sense.
to 15, you're kind of always using it.
Okay.
Even if you're doing this facial or transverse and you're super gingival.
Okay.
Yeah. It's just being more specific about it over here when we get into tap, tap, tap and into channeling.
Okay.
Okay?
Mm-hmm.
So what comes next? Do not use lateral force. So that means, you know, when you're adapting, you're not using pressure, you're not pushing. You're just kind of letting it do its work, and you'll feel it. You'll feel it when it turns on. You'll feel the force of it doing its job. So, and then I said that. So what 90 degrees means is don't use the point, kind of. You know,
Okay.
you don't use 90 degrees ever. And you use your relief, or you're holding the high vacuum, but I believe relief is what I see more, because that's going to be hard for y'all to use two hands. Okay. And then after that is tear down. Okay. So before I move on to tear down, is there anything that I need to go over?
So the nodal point, can we get like a little specific on that as far as like the importance of it? Like what's the point of it?
So it says you want to use 1 to 3 millimeters of the tip of the instrument, right?
Okay.
If you start using further than the nodal point is at your 4 millimeter. If you start adapting this surface forward or up, you're not really doing anything. It's losing the, I don't want to say the power, but yeah, kind of. It's losing the vibration of the instrument, or the power, so you're not getting.
So all the work is
Down
here
at the 1 to
instead
3
of here, basically.
Oh yeah. You're
Okay.
not adapting up here. It's the 1 to 3 millimeters.
Okay.
After that is your nodal point. If you're adapting your nodal point forward, it's not doing a whole lot to remove calculus anymore. It's
Okay.
losing the
Right.
power, the vibration, it talks about it in the video about like the oblique or the oscillating of how the tip kind of oscillates.
Mm-hmm.
We can't see it, but that's what it's doing. And that's how it's removing calculus.
Okay.
So we're going we're going down the road then, like, or they're gonna give us like specifics of what we're gonna be doing.
When you get in your head, you try to go down try to go down in order. So depending on your instructor, they might say, okay, we're gonna do, transverse strokes first. Yeah. But for you, be prepared to present it verbally and know in what order. But I wouldn't be too focused on that. I would be more focused on making sure that you're using the right strokes, that you know your transverse stroke versus your horizontal, oblique strokes, and when to use them. Like if it,
Where are you at? Here, in G, okay, good. And you two are?
Right here.
Right here. Okay, perfect, okay. So some of them are gonna be paired up in an op.
okay. Oh, okay, yeah, because they're to practice on each other, maybe, or
No, to practice on the,
on their
type
type
of
of on. Okay. Oh, okay. I got you.
Cause I'm not doing the, so much right over from the
Okay.
first session. There's a lot of people who didn't get ultrasonic. So this last part, everybody's gonna be doing ultrasonic,
Okay.
but I'm gonna stay after
Oh,
and do the whole.
Columbia.
Uh-huh.
And okay. Alrighty. Okay, so then if y'all want, I can go over this. I don't know how much y'all have